I was just hoping before we begin this conversation to just listen in on what the Minister of Mines had to say, and we'll take it from there.
There are mines that are fully operational, like collieries that supply coal to Eskom, to refineries of oil and petrol. So all those are in full operation. The rest of the mines, there is another category of mines that we said operate at reduced capacity to actually maintain the infrastructure. And there are also mines that were totally closed. Now, in the amendment, we are identifying a risk, particularly in deep mines. If they are left alone for a long time, the stability of the ground get tampered with. Number two, gases accumulate, and you may actually come up and be confronted with disasters like methane gas and other gases, or prevalence of seismicity and rockfall. That's why we say we must allow a situation of phased in recall of workers to work in those mines and actually deal with the question of ramping up the production in those mines. That will do two things: minimize the risk of accidents and disasters. Number two, it will also sustain the infrastructure of production in the mines.
Dr. Balfour, I need to ask, was the Mines Council or the mines industry consulted about some of the new amendments that have been introduced today, particularly that which the mines will now be required to provide screening and testing services as well as quarantine sites for mine workers when they return?
The industry works, on a tripartite basis, which is that, the DMRE, the employers and the employees on most issues consult. And so we were consulted on this. And in fact, we are ready. We have been preparing since February. In February, we mounted our more educational and preparedness sort of phase for the disease. And later in March, we looked at how will we manage cases. And in that process, we then also addressed issues of the screening. How would we screen workers for COVID on a daily basis, and those who then qualify for more extensive tests, how do we test that? And we have linkages in place. All companies have set up systems so that the miners can be tested when it is required, whether it's through the public sector or through the companies themselves and the private sector. And again, we've got extensive plans regarding the quarantine, the isolation for people who have COVID, or quarantining for those who are contacts, for instance, or are persons under investigation for COVID. So, and we have set that up at a regional level so that we don't find each company doing its own thing. And as far as possible, we are trying that it's part of, the region, including the public sector. So already we do have identified facilities, in several localities, Rustenburg, the West Rand, the Mpumalanga. So we definitely, just to cut it short, we are ready for what the minister has announced, and we were consulted.
This is great. It's great news indeed. And Dr. Balfour, can you talk to us about how the resumption of mining is going to take place from the workers' perspective? Because I imagine you'd agree that the workers can't go back to mining as they used to. So this is not going to be a return like, for instance, after the festive holidays or after the Easter holidays, because of the need to still practice social distancing and to still do things gradually. Walk us through how the mine workers will operate when production does come back on stream.
Okay. You are actually quite right. We are dealing with something that we have never experienced before, this virus. And so we also did expect that the best way would be a phased introduction of the workers, so that if there are challenges that are experienced, then those are sorted out and you don't have 100% of the workforce and major problems, on our hands. We actually planned that ideally the workers should be screened even from, furthest from the mine, starting with the home where they are coming from. If, for instance, they are from the Eastern Cape, if it's possible, you screen them from there for whether they show signs of disease. And the transport, for instance, taking them through, as has been indicated, the minister is expecting that companies should provide transport to bring the miners. Again, the screening is done before people get onto buses, so that you don't want a person who has a temperature getting on a bus of 60 people and infecting everyone. And once they get to the hostels, you then, where there are hostels, because not all people now stay in hostels, you screen there. And then on the day a person is reporting for duty, you screen to see if there's anyone who qualifies with suspicious symptoms or signs, of the COVID. And those then who have those signs and symptoms, you then isolate so that you can test them. And if there's, you continue to isolate until you get the results. And depending on the outcome, people might then have to be, the 14 days of isolation. We have also got in place, we have had to ramp up on things like the hygiene of sanitization of areas, hygiene for hands, education, the utilization of masks, because mining does tend to, in some of the areas, have congregations of people. So, number one, we try to reduce those congregations so you don't call up people all at the same time, for instance, for their medicals. And we will be prioritizing medicals for COVID over the usual medicals that we do. So you bring in people in batches so that there isn't too much congregation. And where you cannot reduce the congregation, you also utilize masks so that there isn't any transmission of the disease. And again, we are
Dr. Balfour, one last question. Dr. Balfour, just one last question really quickly. In terms of, you spoke about how you'd be coordinating systems from mine workers who are coming from various parts of South Africa. What about your workers who are coming from Lesotho, Botswana, Zimbabwe, who might come back to work a little later because of lockdowns in their country? What kind of coordination are you having with those countries regarding the screening and testing measures that you're talking about now?
Okay. A number of our companies which have got workers in neighboring countries do utilize DEBA, for instance, for the welfare of their employees, and they are looking at how then they can utilize that organization to do the screening for them before the mine workers come through.
All right.